The challenge that we face in Birmingham is that historically we've often worked as individual organisations. The types of problems that people have now that go across health and social care really challenge us to find ways that we need to work together.
At the moment, if you've got individuals who are talking to social workers and then you have them repeating themselves again to health, how is that good? They get frustrated with us, they get frustrated with health, we get frustrated with one another.
That's 20 times they've got to share their history, that's 20 times they've got to say what's wrong with them, that's 20 times they've got to look at and think, oh, which service have I got to ring for this?
Telephone numbers for mental health services, telephone numbers for community health services, telephone numbers for general practice, telephone numbers for social care, which is a confusion in itself.
Achieving a healthy city in Birmingham is about a partnership between the NHS, between social care and with people and families.
If health and social care work closer together, I wouldn't have to keep telling my story to everybody and Trevor's story, and it would be much better if it was all joined up together and everybody knew what was wrong with you.
It would be lovely, I think, if the people could be treated as a whole person and they could sort of fast track some of these elderly people with all the issues they've got so that their quality of life would be much better.
I think if you ask any vulnerable adult, they actually don't want to go into care and they don't like to go into care. And it's costly as well, not just for us as a local authority, but for the nation as well. The answer is that we all want to remain independent as long as possible, and we want to actually remain in our homes and in our communities.
Just because somebody's 80 doesn't mean they have to sit in a chair, get washed and dressed, have a cup of tea. No, you know, we are really seeing people getting out into the community.
We always realised that there were plenty of lonely people in Birmingham, so we thought, what could we do? So we started a lunch club for lonely shut-in people. We have a cup of coffee or a cup of tea when they first come in, and then we have a few exercises before lunch.
We've had many exercises over the years where we've consulted with people, especially older people, elderly frail people, people who've got various needs and wants, and they consistently say that they'd rather be in their own home for as long as possible with the right support and care.
Many of our people can't actually get out from their homes, so we have a home visiting service, and I've got volunteers and one member of staff that actually go in to homes and visit in the homes.
Birmingham Better Care can help to keep people well where they live by really focusing upon supporting people when they're well, supporting them to stay well, working with their carers to identify it when they are perhaps not feeling quite so well and taking action at an early point rather than waiting until they have a crisis such as a fall or become increasingly confused and need a hospital admission.
If together we can do a better job, and it's certainly our aim, of using the capacity in the community, just simple things like people who are willing to help their neighbours more with a little bit of help from us, then that can go a long way.
It is a community, yeah. Many have been here 10, 20 years or so, and they know everyone.
After they've come for a few weeks, they wish they'd come longer, they wish they'd come before, and they say they couldn't live without it.
One area which seems quite obvious, but it's still something that defeats us, that we need to make progress on, is to have one common access point, one phone number, one email address, that people, residents, carers, people who are stressed out enough as they are, can get quick responses to their queries, to their requests for information, their requests for care and support.
older people generally have quite complex health and social backgrounds, and there are thousands of services out there, and accessing services is one of the problems because it can often be quite difficult. They can often have to use technology they're not used to. They can often be on telephones for half an hour plus trying to get through to someone.
We're aiming to have only one, ideally, telephone number that people can use to ring to get help and then to be signposted to the right services. We're working together with the providers and with the local authority and with the Birmingham 111 services.
111 is a free phone number for people that have urgent care needs. They get through to a trained operator. That trained operator will then understand what the problem is and direct them to the right place first time for the treatment that they need. Therefore, you don't get bounced around the system, which often happens at the moment because people don't fully understand the right place to go.
It really doesn't matter to them whether it's from the NHS, whether it's from the City Council, whether it's from somebody else, but they just need to be assured that if they could just ring one number, make one contact request, that their needs will be met.
As doctors, what we're trained to do is deal with medical crises, and if somebody has a medical problem, then that often will impact on their ability to cope at home. So what starts off as a medical crisis becomes a social crisis or a care crisis. It affects their family. In many cases, older people may be the carer for another older person themselves. So we see the person in hospital and there may be somebody that they look after at home who is then in a crisis situation because of that person being admitted.
There's some great support, but we don't work together enough between various agencies. It could be the hospital, it could be the GP, it could be social workers, it could be a voluntary sector organisation, and I think we can do a far better job, and it's certainly our ambition to join up these services so that they're more efficient as well as meeting people's needs. We need to be clear that we have a common service, a common response, a common offering.
Making sure that people receive the care that they need where and when they need it is about making sure we've got really clear care pathways so that people can flow through the system without any unanticipated transfers between organisations, that it just feels like one service and people don't realise who's looking after them. They just get to appreciate they're getting the right care in the right place.
We conducted an event with health and social care services and identified that there are about 50 different services available to help people in a crisis across the city. However, the people that were referring people to those services didn't know that they all existed, they didn't know what the criteria to get into some of the services were, and they didn't know how to get people out of those services. So our aim is to identify a small number of pathways that work for everybody and to commission services along those pathways, and most importantly, to move people through those pathways as quickly as possible to get them home as soon as possible.
If somebody's feeling that they can't cope, they're under a lot of stress.
One thing that we need to do, and we certainly have that aspiration in the work that we're doing around Birmingham Better Care, is to have one set of paperwork. We limit that. We have one assessment process because there's nothing more frustrating to somebody in a time of need, in a time of crisis, when there's lots of different people coming in and out of their home or whatever situation they're in, asking similar questions.
My opposite numbers in social care very often get on very well with me as a person, but as soon as the systemic problems of me asking them to do their own assessment when I've already done my own assessment, as soon as things like that occur, it's very hard to stay cheerful and optimistic.
When we're making decisions when people have got much more complex care needs and where families need a little bit more support, it's important that we can understand what information's available from our side of the story, but also actually what they know about their condition. And so it's important that we involve them all the way through that journey.
So we're aiming to streamline the assessment process, to have a pooled budget which will allow the right care to be put in place without any discussion about who should pay for it, and also to then work actively with the market to try and develop new types of care that are perhaps more appropriate for people at this time.
What we need to be clear about is that for people's experience of services to be better, we need to make it clearer to them what they can expect and make those expectations come true.
A close working relationship between the hospital team, the ward team and social workers is essential. In recent years that relationship hasn't been strong, and the hope is that with Birmingham Better Care that relationship will improve.
I think we all need to understand what each individual's doing and what we're providing, and provide a holistic approach so everyone understands that we all are singing from the same hymn book.
Integration of health and social care reflects the fact that actually people are so much more than an individual disease, and actually there is no longer a simple boundary between what is health and what is social care. Actually that wider environment affects all of us when we're dealing with a medical problem, and actually it's important therefore that we don't have a false boundary between those two areas.
I think the Better Care Fund gives us a vehicle for both local authorities and the NHS to really come together as true partners and look at co-commissioning services together, because rather than working in silos, I think it's about time we actually put our differences to one side and say, right, okay, we got to look after the service user here and the citizen, and put everything else aside and say, right, well, how are we going to actually move forward and deliver the services?
I believe that we all come to work to do right for the citizens of Birmingham. What would really please me is if that we all shared that space, all shared that ethos, all shared those core principles of what we're here for, what we're trying to achieve, serving the citizens of Birmingham well. And I think if we did that together and lost sight of our organisational position, I think that would be a much better position for citizens of Birmingham.